This meeting is now called to order. Let's take roll call attendance, please.
Yeah, Barbara Griffin.
Kelly Bigley.
Kevin Kraus.
Susan Ivashevic.
Rob Perkins.
Bethany Hallam.
Manny.
Okay, community corrections reports, passages to recovery.
Your Honor, currently our census is 24, and we have 32 open beds. Anything else you need?
Yeah, a lot more than that.
No escapes, so no revocations for the month of February. So,
Mr. Perkins, I see you have a question. You've turned your red light on.
I'm sorry, I missed. How many open beds did you have?
32.
32. Mm-hmm. Thank you.
You're welcome.
Anybody else?
Any overdoses?
No?
Any people sent to the hospital?
You have none, no overnight stays.
No overnight stays. Okay, thank you.
You're welcome. That's it.
Okay, thank you. Renewal.
Good afternoon, everyone. Darren Hood, HOOD, Director of Reentry Services with Renewal Incorporated. Today, Renewal contracts with HCJ to provide 180 alternative housing and drug and alcohol inpatient beds. We currently have 85 county work release mills and 18 county mills in our drug and alcohol treatment program. Total county mills is 103. Total county females are 15. Total contracted beds filled, it's 118. So Renewal has 62 empty contracted beds right now. So 62 open beds. Releases, we had 74 reentrants exit the program, 54 successful, 20 unsuccessful. 12 of those were escapes, 8 program revocations. Some were revocated due to court decisions, and others were returned for behavioral issues. We had 0 deaths. We did have 1 non-fatal overdose. It was believed to be an adverse reaction to synthetic marijuana. Hospital discharge paperwork, physician's diagnosis indicated altered mental state, plus his urine did not test positive for opiates or fentanyl. However, we used Narcan, so when Narcan's used, it's classified as a non-fatal overdose. We had 0 use of force, 0 incidents of self-harm, 0 suicide attempts. The number of times emergency medical services were called to either building for county reentrance was 8 since the last jail oversight meeting. EMS were called for the following conditions: twice for breathing difficulties, once for a seizure, once for chest pains, once for a suspected overdose, once for severe back pain, and 1 for an allergic reaction to medication, and once for muscle aches. Reentrants continue to participate in community service at various human service organizations within the Pittsburgh area. West End Power and Pennsylvania Interfaith Impact Network are training formerly incarcerated people to build their employment prospects through a program called Colorful Backgrounds Expo. They both visit our facilities to present their initiative, and we have several county reentrants registered to participate in this program that offers job readiness, computer, financial skills, along with expungement clinic. The ACAR Reentry Summit is next Friday, March 13th. The ACAR Reentry Summit is an event organized by the Allegheny County Anchored Reentry Coalition, focusing on supporting individuals returning from correctional facilities. Renewal will have a table at the event with numerous staff and reentrants registered to attend this event. Also, Renewal is excited to announce that it is in final preparations to open its recovery house. All jail oversight board members will receive an invitation to our facility before it is open for operation via email. Any questions?
I had a question about folks who are in the work release program and seeking employment. I was wondering if you guys have like a set policy of the types of jobs. Like, for example, I know they're not allowed to work jobs under the table, right? It has to be like W-2 jobs. Is
Correct.
there other guidelines about the types of jobs they can have? Because I think they're also not allowed to have jobs where they're like driving for the job, right?
Like moving companies and stuff like that, driving, they're not, we have to receive authorization from jail staff for driving. So we try to discourage those type of jobs, especially moving companies, because really moving companies, in order to be a viable moving company, you have to move outside the Allegheny County, and so they're restricted to Allegheny County. Other jobs like beer distributors, CBD dispensaries, stuff like that, we kind of try and discourage them from. Commission-based jobs, because there's no steady, base wage. So in order for them to secure housing on their own, they don't know how much money they're going to have. So, in order to secure housing. So we try to keep them away from jobs like that. Personal care, child care, things like that. Telemarketing, sales jobs, things that, that may have access to financial information, such like that.
Okay, and is that like a written policy that you could email me?
Not really. There's nothing in writing about specific employment.
Okay, it's just kind of like subjective, like you review on a case-by-case basis?
Correct.
Okay, and then my...
Discretionary, common sense as well.
Okay. And then you have a lot of open beds. I hope these other folks here are working
62.
to fill them. Yeah. But my next question is just about, is there ever a situation where someone comes to renewal, like not from a sentence, like more in like a halfway house, three-quarter house type consideration? Like they've been on the street, they maybe for a year or so since they've been home, and they need like a halfway house, three-quarter house type thing, or do they need to be ordered to you from the court?
Yeah, we have to,
Okay.
Anybody that comes into our work release, it's generally court ordered.
Okay. Okay.
Now, our recovery house will probably honor those type of situations, absolutely.
Awesome. And what is the ETA on that? I know we'll get an invite. I will be there, but what?
Just wait, finalizing
summer?
staffing and stuff like that. So you'll get a notification and an invitation, like I said, for a tour before we open up for operation.
Okay.
But to give you a hard ETA, I don't want to
Like
do that.
summer, are we thinking, or sooner than that?
Probably sooner than
Okay. Awesome. Thank you.
I do have one
Yes, sir.
question. What is the renewals policy as far as sending people back to jail or having people arrested on escape charges? Like, for example, if you are late, but if you eventually come back and you're in contact with renewal, would a warrant be issued, or would you be arrested for escape? Or is there a written policy on that, or what is your policy generally?
Again, that's determined by jail, the jail staff. We've had several people that reported back to the center after escape charges were filed and there was a warrant issued. At that point, the sheriffs do come and remove that individual. And basically, it's just because the warrant was issued. We have no control of that.
Well, assume like there's no warrant and someone just shows up late. What does renewal do? Do you?
We contact the jail and say that they're back here, and then generally they stay if there's, depending on the time. So for the most part, if they're back and the warrant wasn't issued, 9 out of 10 times they stay. There's not an issue.
Okay, is that a written policy, or is that just kind of like custom? That's the way you do it?
That's not our policy. That's determined by the jail.
Okay, so if someone's late, you call the jail, and the jail says, you know what, issue a warrant for their arrest for
Right.
escape.
We have a time period to report, a failure to return or late return. And within that time, if they're not back, then, the paperwork gets in process. And if the escape warrant is issued, basically they don't pull that back. They come and they detain that individual. But if they get back before that warrant, generally it's rescinded.
You say, so as far as your internal time frame, is it like an hour? Is it a day?
It's set by the jail.
Okay.
We have 2 hours to report it, 3 hours to get the paperwork in.
Okay. Thank you.
So if they're due back at 4, we have to report it by 6, and then by 7, all the paperwork has to be to the delegated personnel.
Thank you.
You're welcome.
Yeah, just one question. Happy to hear that you partner with West End Power. I think they're a great organization. I think they do a lot of good work in the community. My question is, I'm wondering if you could just talk a little bit more about that, how that went, and how often you partner with community organizations.
Well, we partner with all kinds of community organizations. A lot of our employment opportunities come through partnerships, like with TIP, Technical Institute of Pittsburgh, its masonry program, and some carpentry. As far as the West End Power and Pennsylvania Interfaith Impact Network, we've dealt with them in the past. They just came in a week ago and presented to our population. And again, like I said, several people registered, so there's going to be more contact, soon as we move forward with the people that are registered. But we're in contact I'd say monthly with them, with updates with what's going on and the people that we have involved with them.
Electronic monitoring?
Good afternoon, Board. Renan Harris, Adult Probation, HARRIS. So for this reporting period, we had 544 supervised individuals on the electronic monitoring bracelet. 73 of those individuals successfully completed the program, and 11 were returned for program violations. Any questions? Yes.
Do you guys help folks get housing who are on electronic monitoring if they're at risk of losing their housing?
Yes.
Okay.
The probation officers do all that while they're on house
Housing,
arrest.
employment.
Housing, employment, work things, anything of that nature.
Awesome, thank you.
Before it gets to the level where it needs to get to. So
Okay, thank you.
you're welcome.
Anybody else? Thank you. Okay, I'm told there's no public comment on board actions. Can I have a motion to approve the meeting minutes for February 5, 2026?
So moved.
Second?
Second.
All in favor?
Aye.
Any opposed? Motion carries. Any updates from any of the committees?
Barbara, do you want to give an update from us?
The use of force committee met week before last, I believe. We talked about a particular incident that occurred in intake with a person having a mental health crisis, and the treatment she received, which was not good in her opinion, although it improved later. The next morning, things got a little bit better. But we talked about that, and we asked for some information through our jail liaison about that incident, watching the video. And I think Councilmember Hallam also watched it. I did not, but I read a brief report about it. We are also looking for some more information, which we haven't gotten yet, on use of force, and in particular, the strip searches, how often they're ordered, and who orders those, and just to see if there are trends among those orders and how they're working. So we're still waiting, I feel like, some more information back from both our jail liaison, and I know I did mention this briefly to the warden at another recent meeting, and I think you did say that you're willing to compile that information or working on compiling that information. So anything else from our committee? Do you want to add? Okay, thanks.
Maybe I'll just add, I did go and watch the video of that incident, and it did seem someone was in a moment of crisis. And I didn't see anything that I thought was inappropriate that happened in the video. And I'm always looking for it. And I did not see anything inappropriate that happened. It just seemed like it was someone who was in a moment of crisis, and maybe, just a bad place to be if you're in a time of crisis. So.
Thank you.
I'll give an update on the healthcare subcommittee. So we met for, our fourth quarterly meeting, and the jail administration brought a lot of the mental health staff, and it was a productive conversation. I guess some of the highlights that we heard was that the director of psychiatry left, and we are going to be searching for a new director of psychiatry now and in the near future. We heard about lots of efforts to kind of transform or at least significantly change some of our practices within the jail as far as mental health care is concerned. It seems like a lot of exciting momentum moving forward. Trying to think what else. It's my understanding we'll be receiving soon the next quarterly monitor report, and continue to hear good things that the jail administration looks at the settlement as not a hindrance, but as a way to improve and to collaborate and to work with the monitor to continue to improve conditions. And it's good to see that the positive attitude with that. And I think that's a quick summary. Barbara, did I miss anything? Thank you.
Okay, moving on, new business.
Motion to approve the JOB.
So there is a motion directing the development of a revised medical notification policy, providing for timely and expanded notification to family members and other specified persons in the event of an incarcerated person's hospitalization.
I'll second that, Judge.
I'm going to make a motion that we postpone this motion until next month. And the reason is basically professional courtesy, okay? The jail administration was just given a copy of this motion. They would like some time to digest it, to review it, to meet with their stakeholders. And I think that as a matter of courtesy, we should give them that time. And if we consider the motion next month and keep the deadline June, there's no harm done.
Judge?
Yeah.
May I? Thank you very much.
Oh, hang on, does anybody second my motion to postpone?
I'll second the motion.
Thank you. Discussion.
Sure, thank you. Yeah, so just a couple things here. First of all, this is something we've been talking about since 2020. I have been on this board since 2020. This is something every single judge that has sat as the chair of this board has discussed. This is something that has been going on forever. It's literally letting families, attorneys, and the Jail Oversight Board know when someone is in the hospital, which, as you can imagine, is something that causes much chaos and confusion for loved ones of people that this is happening to, and attorneys who are expecting to go see their clients to prepare for trial, and their clients just not at the jail and no one knows or is able to tell them where they are. And so while I understand the argument that they just got this specific policy this week or a week ago, which, by the way, all this policy says is jail, please make a policy by June. That's all that this says. It doesn't dictate any specifics whatsoever. But we have had meetings. Rob and I had drafted a policy ourselves months ago and just had meetings with the jail administration about it. And it was decided instead, no, we'll let them make the policy and we will just do this motion instead. So to act like this was something that was just sprung on anyone, I believe is disingenuous, because it's something that even amongst this board and this jail administration, we have been talking about for months, and we have given the courtesy of waiting and waiting and waiting. And it is dangerous. It does put incarcerated people at risk when they don't have their support system knowing where they are. It puts people, whether corrections officers or sheriffs, at risk at the hospital when people are showing up at all the hospitals wondering, where is my loved one, hearing rumors from other incarcerated people that they died whenever they're fine. I mean, the misinformation and the lack of communication is what causes the chaos. And I think delaying this even a little bit longer is just another excuse for I don't even know what reason. I feel like it's something we should give them ample opportunity.
You're arguing the merits of the motion.
No, I'm not. I'm arguing what happens when we delay this any longer.
Okay, but
And why it shouldn't be delayed, because this was not an issue that was sprung on them a week ago, as was just referenced in your motion to delay. It instead is something that we have all been talking about, again, myself on this board for 6 years now, this whole board and this jail administration since before our current warden even got here.
okay, but now we have a new warden, we have new jail administration.
Since they've been here, Judge.
And I am only proposing that we delay this 1 month with no delay in the June consideration of the policy, which is in the motion.
And why? Why is that? If all we're saying is please work on a policy and they're saying give us a month, we're going to work on a policy, I don't understand.
Honestly,
yeah.
Professional courtesy. These people work very hard. They
don't
are
disagree.
very transparent. they communicate and cooperate and are reasonable and are rational. And if they ask, can we have a little more time to look at this? As a professional courtesy, I say yes.
Yeah, but if we're agreeing that by June it will happen anyways, what does a delay on this vote
Okay,
change?
well, does anybody else want to say
There are
anything?
some, oops, I'm going to, this is on. There are some specifics in here that I think they do need to address specifically. I think the concern is there's some specific dictates in here regarding council and things that they may want to try to see if they have the ability to comply with. Specifically, a lot of the time, I don't know how they know who somebody's counsel is. I know as even the court, half the time, we couldn't discern exactly who was counsel at the time. So I think that's the concern. Again, if you're not pushing the date out being effective in June, and it's just giving them time to see if they have the ability to comply with the exact dictates of the motion, then there's no harm in putting it to next month to see if they can comply, because the motion is very specific, not just with the notification of the families, which I totally get, but it's requiring notification to other parties, and the concern is that they wouldn't be able to comply with broad notification of other people. And so that's where I'm in agreement with the jail being able to look at those additional parties.
Does anybody?
Yeah, I'll add, I agree with pretty much everything Councilmember Holland has stated, that we need to do this. We can better balance compassion and medical care with operational and security needs by having a more expanded policy. And ultimately, why I'm in favor of continuing it is because it doesn't impact, like right now, if we pass the motion today, then the jail comes back with a policy in June and this board considers it. If we vote on this next month, it's the exact same outcome, that in June, we're going to get a policy and we can vote on. As far as what we're dictating, I think Councilmember Holm did accurately reflect, we're not dictating much. What we want is more notifications, more consistency in making sure we have emergency contacts so we can get hold of people. So it's both the expansion of notifications, because right now it's very limited to someone who has a life-threatening illness, which is not very well defined and, in my opinion, too narrowly circumscribed. But the other issue is a lot of times we don't even know who the emergency medicine contact is. So there can be, I think, an improved policy to make sure we have that information. We're not dictating that an attorney be notified, every time someone leaves for a dental appointment, but we are saying as appropriate, and we're relying upon the jail's expertise, listening to our input and our feedback and talking to stakeholders, which I would ask you to also talk to the public defender's office, because they can talk about situations where attorneys have been impacted by this policy and where their clients and their families have been impacted. But ultimately, it doesn't hurt, and I think this administration has earned the board's trust. And if they ask for it, I'm inclined to grant it, particularly with no harm to the ultimate outcome of having a new policy in June.
Yeah, I agree with what you're saying for the most part, Rob. And of course, when I'm thinking about this, I'm thinking about it from the perspective of the people who, may have family and friends who are unaware of their whereabouts. This is something that I experienced personally, and what Bethany said is absolutely correct. I mean, the people who are incarcerated, when they start talking, rumors spread. I got a phone call that one of my relatives was dead in the jail. It was because we had no formal contact, from the jail, and this was a few years ago. I think the harm that it causes is within that month, there could be somebody who has to go to the hospital, you know what I mean? And right now, there's no official policy, and this is something that we have been talking about for a long time. And this is something that people have been dealing with, and I would say on the receiving end of some harm with for a long time, for years now. And, and I understand the professional courtesy as well. I'm going to vote to not delay it. I understand if you vote to delay it, but you got to think about the people who are there now, you know what I mean, the people who are going to be impacted now, and people who are looking to us to make decisions now, not just next month or kicking the can down the road, you know what I mean?
Can I just say, we do have a motion in a second. We do have to vote on it. I just want to make sure we are doing proper procedures and we're not tabling this. I want to make sure that it's the same exact language.
I made a motion.
But I made a mo-
postpone it till next month.
You made a motion first for the motion, and I seconded it. So I'm saying,
So, but. the
I think
motion-
that what should happen, Robert's rules appropriately, is there is no motion to postpone, motion to delay. That's not a thing that exists. I think if you want me to withdraw my second to the original motion, just because I'm so nice, and it seems I don't have the votes up here for it anyways, I will do that. But I do want to be careful at how we just don't acknowledge it, just for procedural parliamentary
I believe
purposes.
that Robert's rules dictate that the motion to postpone this gets voted on before your original motion. And I'm saying to postpone it to the next meeting, the
I don't think there's a motion.
April meeting.
Yeah, she made a motion to postpone.
Yes, I did.
Okay.
Rob seconded it. Okay, so on the motion to postpone the motion regarding medical notification policy to the April meeting, Manny,
No.
Bethany,
No.
Yes.
yes,
Yes.
Yes. Yes.
Yes.
motion carries. Next motion is to approve the agreement for the job solicitor position, and we have our solicitor here, Mr. Alexander. Welcome. Happy to have you. Do I have a second on the motion?
Second.
Do we want roll call? Got Manny?
Yes.
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 Yes. Yes.
Yes.
Okay, motion carries. Warden's report.
Good afternoon, Board. So as you know, we needed to present our 2025 annual report. We will be as brief as we can be. I just want to say a few things before I turn it over to these folks. So as you all know, through our discussions, several of them this past year, 2025, we've had a lot of change down there. So many changes, we can't list them all here. We put them in the report, most of them in the report that we sent you a few weeks ago, but we wanted to just do some highlights tonight. I just want to say a couple things. I don't know if everyone's aware that we have about 1,000 employees working down there now. That's, about 670 Allegheny County employees and several hundred contractors. Most of them live here in Allegheny County. I think it's important for people to realize that. As we go through, as the team here goes through the highlights from 2025, I just want to say that there has been missteps. There's been issues in the last 13, 14 months. I think that every time that happened, we've told you when obviously we were transparent as we can be on those things. We'll continue to do that. That's our pledge to you, to continue to inform you what's going on. Our successes with you and our missteps, we will inform you about. Before I turn it over to this team, I want to talk about one of those successes that I got to see personally. As you know, we instituted a program called, not a program, but new employees called unit managers this past year. And anybody in this room or listening who's been in that facility the last 6 months, who's encountered these folks, will tell you that they're working hard to bring consistency and continuity and just better responses to the incarcerated folks and their issues in the facility. And we have them on every floor of that building now. And back in the fall, I got to go to Philadelphia to see something that I wasn't sure I'd see in my 30-plus years in corrections, and that was the Pennsylvania Prison Society honored a unit manager and his job he's doing here at the ACJ, and especially how he handles the juveniles in that facility, and that's Gerald Roundtree. And I got to go to Philadelphia with him and his family, and the Pennsylvania Prison Society did an incredible job honoring him. And I thought it was interesting that during his speech, Ms. Hallam called me about an issue in the facility, and it was an issue with a juvenile, and it was a serious issue. And directly 2 seconds after his speech, I talked to him, and he knew exactly what I was talking about. We put mechanisms in motion to address what Ms. Hallam called us about, and there was a really good as outcome as we can get. I'm not sure how that would have been handled in the past. before unit managers or before someone like him was there and had the relationship with the juveniles down there that he has. But it was, I think, ironic that while he was being honored by the Prison Society, I got a call about an issue going on with the juvenile. I'm not sure if you remember that or not. But that's just one of the several changes we've made, and I wanted to mention how it was great to see a stakeholder who works with us honor one of our own. So I'm going to turn it over to Chief Estock. He's going to talk about some other changes, then a few of us are going to talk about changes, and we will try to be as brief as possible.
Thank you, Warden. I'm going to talk about the restructure of our organizational chart at the jail. I'm going to start off with unit managers. The introduction of the unit management concept has resulted in a wide range of outcomes and continues to evolve this day. We consider them wardens of their level. The positive outcomes include enhanced communication with both staff as well as the people living on the levels. Ensures more accountability. The incarcerated population has someone to turn to for any problems, and the unit manager will ensure that the issues resolved where possible. One person that is responsible for the overall operations of the area or level. The unit manager has an invested interest in the success of their level. Obviously, the unit managers are a big part of the adjustments we've made down there. Communication has increased greatly since the unit manager has been there, and I think their resolution process has actually increased as well. It's definitely an improved process. I'm going to get a little bit into the majors. 2025, we made specific changes to our operations within the administration. Prior administration assigned each major to a shift, which promoted and facilitated 3 different operations within our facility. We chose to reassign majors to specific areas within the operations and promoted overlap between the majors so we can develop as a team and not work against each other. The major of the guard is in charge of corrections officers, sergeants, and captain complement complement control for scheduling. Initiates policy change and enforcement under the direction of the deputy warden of operations. They also include shift operations to schedule and post analysis within the facility. The major of special management supervises our special management units, the RHU and the DTU. The RHU is the restricted housing unit, and the DTU is the diversionary treatment unit for our mental health population. The chairperson for the program, the major of special management is also the chairperson for the program review committee. They review pretty much weekly time cuts, housing changes, problematic behavioral issues. They're a member of the problematic case committee. They do individual behavior management plans and individual treatment plans. They're involved with that process, so we have multiple disciplines within the room to develop these plans. They initiate policy change and enforcement under the deputy warden of operations. The major of security and intelligence. They're responsible for supervising and directing our security and intelligence department. The goal is to use intelligence to prevent problems before they are a problem. Drug interdiction and any other activity which reduces violence and contraband introduction. They work closely with our internal affairs division. They report directly to me, the chief deputy warden. The major of unit management, which is Major Jack Mancheri. He always gets put up on the slideshow for whatever reason, but he's always around. But he supervises the unit management teams to ensure the unit management concept is being used. Communicates and ensures the unit management teams are appropriately supported to do their jobs. Initiates policy change and enforcement under the direction of the deputy warden of operations. Our acting deputy warden of operation, Eric Hintemeyer, is right behind me. Acting deputy warden of operations is Eric Hintemeyer. I've worked with Eric for more than 25 years, and I know he has the highest level of integrity and work ethic. I'm glad to have him on board as one of our team members. The Deputy Warden of Operations has a new role as well with the reorganization of our majors. This includes supervision of the Major of the Guard, Major of Special Management, and Major of Unit Management. The Deputy Warden of Operations is a direct report to me, the Chief Deputy Warden. So,
in January last year, our healthcare team achieved accreditation from NCCHD, the National Commission on Correctional Healthcare. It was a collaborative approach from the entire healthcare staff alongside the operations staff. There were 57 standards that we were surveyed on, and we passed each standard with 100%. Our healthcare department in 2025 continued its mission of change, program growth, process improvement, and increased collaboration with an added focus on comprehensive healthcare. The team once again came together to overcome many obstacles and move this department forward. There have been many accomplishments, and below are just some of the highlights for our year. We visited and met with many different universities and institutions, including Carlow, Washington Jefferson, Wilkes, CCAC, Geneva, and Allstate Career School, to present correctional medicine opportunities available to students. Our staff facilitated an on-site blood drive. We implemented a Nurse Star Program of the Month, which is a recognition initiative aimed at celebrating the exceptional contributions within an organization. Within our healthcare team, we created and launched a diversionary treatment unit to divert patients with serious mental illness from typical restrictive housing units to a treatment-focused and mental health managed unit. This team consists of mental health professionals that work on that unit, including a psychologist, behavioral health consultant, RNs, mental health specialists, that all participate in treatment teams and groups. In conjunction with DHS, we launched a mobile competency restoration team to offer competency restoration to patients otherwise court-ordered to Torrance State Hospital. The successful program diminished the wait times to determine competency for the jail's court-ordered patients. The restoration team works within the jail and consists of a mental health nurse, peer specialist, mental health therapist, competency to support specialists, psychiatrists, and JRS workers. We've also fully onboarded the 8 mental health therapist team. They began offering therapy to all the positive populations, including the RHU and juvenile units. They assessed a total of 780 patients for treatment last year. For our substance use team, we expanded the MAT services to now include all MOUD medications and the induction of methadone. They expanded services to the juvenile population, which they observed a significant participation in their programming. They increased SUD staff and programming to across all levels of the facility, and they created handouts and educational materials for the population to increase participation. For our physical health and public health teams, they've established monthly educational materials to share with all the staff and ACJ residents that goes out on the tablets. The material highlights health topics relevant to correctional settings, aiming to increase awareness, promote prevention, and encourage a culture of wellness across the facility. They expanded the infectious disease prevention and treatment services. They strengthened the STI testing and treatment efforts, enhancing hepatitis C monitoring, and increased vaccine administration for the incarcerated population. They increased vaccination access and coverage by providing more than 400 vaccines, which include the flu, COVID, hepatitis, pneumonia, and shingles to individuals in custody. We improved collaborative efforts with partnering hospitals who receive our patients. Our medical director and other AHM representatives, along with jail administration, toured our local facilities that our patients go to. We met with hospital leadership, including doctors, discharge planners, and their security teams. We improved collaborative efforts with operations teams for more standardized medication times and processes, and we added EMS clinicians to our intake areas to assist with triaging, screening, and responding to medical emergencies. For training, our staff participated in many opportunities this past year and from various different organizations. That includes Autism Pittsburgh, AHN Grand Rounds, the PA Department of Health, NCCHC, ACA, ACNA, the NIC, and PAR. And 4 of our healthcare staff received their Certified Correctional Healthcare Professional through NCCHC. In 2026, we look forward to expanding our medical services being offered, providing specialized training with staff development opportunities, and increasing collaborative relationships with the higher education institutions.
2025 was an exciting year for programs. We had a couple of new positions start. The Foundation of Hope hired Reverend Dr. Tammy Hooker, who is the part-time staff chaplain. The purpose of her role is the overall promotion of staff wellness. Working in a correctional setting can contribute to mental and emotional stresses that are not found in other work environments. Reverend Dr. Hooker works all shifts and meets with staff to talk about how she can better support them. Due to the continued increase in the jail's population, Gary Copeland was hired as the population manager. The role of the population manager is to collaborate with the courts and other stakeholders, refine processes, and make improvements that will lead to reduction in the overall population of the jail. With the support of our colleagues at DHS, we re-envisioned the jail reentry program in 2025. We contracted with community providers who do great reentry work in the community and brought them into the jail, leveraging their expertise to support the population. An integral part of the enhancements made to the reentry program is our partnership with the Beck Institute. The Beck Institute is a leading international resource for CBT and CTR training. Cognitive-based recovery-oriented therapy has been incorporated into all reentry programming. This allows us to focus on the strengths of each individual and use those strengths to empower people to make the changes that they envision for their lives. In June, the TAILS program began. In partnership with Animal Friends, the jail is fostering dogs who would otherwise be in a shelter setting. Handlers in the jail teach the dog basic obedience, which makes them more adoptable. To date, 8 dogs have been adopted through the TAILS program. The program has been exciting for both staff and residents of the jail. In a recent conversation with one of the handlers, she spoke to me about how meaningful the program was to her. She said the program's had a very positive impact on her mental health. In 2025, the jail hosted 2 graduation ceremonies with a total of 26 graduates. Families were able to be present for the graduations to support their loved ones. The Education Center in the jail does incredible work with the adult and juvenile learners, and we appreciate the dedication and passion that they bring to teaching incarcerated learners. In partnership with the Allegheny County Library Association and with support from a legislative grant secured by Senators Jay Costa and Lindsey Williams, the jail installed a book vending machine in the visitor lobby. When children visit the jail, they receive a token from the officer and can choose a free book to take home. This initiative both promotes literacy and makes the jail a more comfortable place to visit for children. In April, the jail hosted the first volunteer appreciation event. We have volunteers that come into the facility on a daily basis to provide support to the incarcerated population. Everything from religious services, NA and NAA meetings, voter registration events are all run by volunteers who dedicate their time to serving the residents of the jail. Last year, Lorraine Cross from BPEP and Amy Kleisis from League of Women Voters were honored as Volunteers of the Year for their work in voter education and registration. Due to time restraints, I couldn't possibly speak publicly to all the incredible accomplishments that the program team made in 2025. I do want to take this opportunity to sincerely thank the employees and contractors who show up every day to serve the residents of the jail. They are passionate about supporting the population and truly making the jail a better place. Each of them does something every single day that positively impacts people at a time in their lives when they need support the most. In addition, you probably noticed that I've referenced many community partnerships and external organizations that support the work that we do. The jail is part of the larger community, and we recognize that we need community support for the residents of the jail. I want to say thank you to all of our partners and colleagues who bring specialized services and supports to the residents of Allegheny County Jail.
And for community service, June of 2025, we started an initiative, Community Service. The goal was have a quarterly event. In 2026, we had 6. So the generosity, compassion, and engagement of the employees is really appreciated, and we were able to do way more than we ever considered. When it says employee wellness, 2 of our challenges were retention and recruitment. So I wanted to make sure we told you that we had 11 on-site recruitment efforts, and we had 10 off-site recruitment efforts, which if you take our outcome of December 24 to December 25 year, we ended up with a 7% increase in staff. Most of that went to medical, and a little 4% portion went to corrections. So really appreciate everybody's effort, because it took the whole organization to participate in that to get those goals. And that's the end of our yearly report. We'll send it back to the warden for our monthly report.
So just a few items. On February 10th, we honored our correctional food service employees down there. It was a Correctional Food Service Professionals Day, national. As everyone knows, we have Trinity Food Services down there. We honored them with a thank you and brought them together to meet our whole entire team. And their CEO came in, I think from Colorado, to meet us, and that was a good day to honor them. So a couple things we're looking at doing over the next few months, we'll report back when we get there, is we're looking at setting up a legislative day where we invite the local reps in for a tour, along with a media day where we invite the local media in to come in and tour the facility. We've had some media in. We had a media person shadow a few of us, or me, I guess, back about a year ago. We're looking at doing more of that. We've had a lot of new judges, or we've had a lot of judges the last few weeks come down and tour the facility. That went well, and then tomorrow we have the new Common Pleas judges coming down for a tour who just got started. So we're looking forward to that. We had 13 cadets graduate 2 weeks ago, and happy to report we have 26 new cadets starting in 2 weeks. That's a large class for us, very large class, one of the larger ones I've seen. So looking forward to getting them on board. That's all I have. Thank you.
For healthcare February data, for MAT numbers, we have 24 individuals on naloxone, 3 receiving Vivitrol, 334 individuals were treated with Suboxone, 45 with Sublocade, 15 with Brixadi, 141 with methadone. For Torrance commitments and admissions, 8 were admitted and transferred, 10 were committed, 0 had their commitment rescinded, 18 are on the wait list, longest waiting since October. For Tier 4 and 5 data, 0 were identified as Tier 5, 21 were identified as a Tier 4. And for mobile competency, they are serving 94 patients, 67 are within the facility, and 27 are in the community. They did have 1 commitment rescinded from their caseload.
For programs in the month of February, the Discharge and Release Center received medetomidine test strips. We currently distribute fentanyl, xylazine, and now medetomidine test strips for people as they're releasing from the jail. So we appreciate the support of the health department to make that happen. Casa San Jose completed a couple of education sessions with various teams in February. We appreciate their continued support and partnership. In partnership with Community Kitchen of Pittsburgh, Serve Safe and Restaurant Ready classes began on February 10th. Upon completion, participants will have 2 industry-renowned certifications. On February 25th, the jail obtained a dog kennel license. The license is for facilities that house over 25 dogs in a 1-year period. As the jail looks to expand the TAILS program, we wanted to ensure compliance with state requirements. The inspector had positive feedback about the program and the care that the dogs are receiving. On February 6th, students from Washington and Jefferson College who are interested in pursuing careers in corrections toured the Education Center with teachers and staff. In February, the U.S. Department of Veterans Affairs began holding a monthly class to discuss a variety of supports for veterans, including health care, housing, employment, vocational services, and substance use treatment. Yesterday, in collaboration with League of Women Voters and the Black Political Empowerment Project, voter education and registration events began in preparation for the upcoming primary election. We would like to thank all of those volunteers who come in to support that initiative. On February 23rd, Semper Fi Mission celebrated their 100th visit to the jail with a group celebration and contact visits. Several speakers came to celebrate, deliver ministry, and share their message of hope. The organization provided specialized meals for nearly 50 participants. I want to extend a special thank you to Penn and many volunteers and supporters that have helped us with book drives through varying churches throughout the area. We appreciate those book drives and look forward to continuing to partner on those. In the coming months, and as I said in the recap of 2025, the jail has contracted through DHS with several reentry providers. And so we have asked those reentry providers to come and speak at each JOB meeting, just give a few-minute overview of what their services are and how they support people both inside and outside of the jail. So tonight from Awaken Pittsburgh, Dawn Lehman's just going to give a little update on what it is that that organization does. So Dawn?
Okay, thank you so much, Connie. I'm Dawn Lehman, Program Coordinator with Awaken Pittsburgh, and if you're not familiar with us, Awaken Pittsburgh is a secular organization that draws on the wisdom of mindfulness and meditation to serve the public. And we have a flagship community training called Mindful Connections for Wellness, which helps people to establish and maintain a personal mindfulness practice. And part of our mission is to make mindfulness tools accessible to folks who might not otherwise be familiar with them. So partnering with the jail and reaching folks there is right in line with what we want to be doing in the world. So we tailored a particular training to this population, building on the knowledge that we already have. We tailored a course called Mind Training for Successful Reentry. And we have a 4-person team. 2 instructors at a time are leading our 4 classes a week. We're in there on Monday and Wednesday mornings at 8:30 and 10:30. And so we have a 6-week curriculum. It's 12 sessions. The first week we're doing introductory materials. The second week we have decided that we will do mindfulness for stress reduction, knowing that that is universal and everyone can use those tools. The remaining 4 weeks, our approach is that in those introductory sessions, we give an overview of our 8 topics and we allow the participants to engage with that content and decide which ones are most pertinent for them, which ones will support them. So the topics in general are things like managing emotions, trauma, thinking, building resilience, living our values, cultivating joy, and caring for the mind and body. So it's all based in social emotional wellness, complemented by mindfulness practices. We provide everyone a workbook, and our materials are very much in line with the philosophy of the Beck Institute, increasing the awareness and self-regulation, training folks to observe thoughts and feelings without judgment, creating that space between stimulus and response so that folks can reduce the impact of distressing thoughts and be in conscious choice with decisions that they make. So we have really been enjoying this training, and the participants have been enjoying it as well. They often say at the end, we wish the class could be longer. Awaken Pittsburgh is heavily committed to research and our own programming. We have very extensive pre and posts. We narrowed that down for the jail to reduce the time of that, but we have been offering pre and posts with drawing from a range of standardized tools. So each class we're asking questions like asking folks to rank things like, I'm generally aware of how my emotions affect me physically. I'm able to be compassionate toward myself. When I get distressing thoughts, I can just notice them without reacting. So a whole range of criteria that we are asking folks to rate, and across the board, each of our classes have seen an increase in those facets of mindfulness. So we are happy for that, and we are also happy for the individual input that we get. Folks are naming that at the end of the class, they will incorporate practices into their reentry, practices like breathing techniques, mindful check-ins, grounding techniques. When asked what were the 3 most helpful things you experienced through these lessons, We heard things like dealing with stress, how to understand myself, being mindful to others, understanding emotions. We also heard things like joy, the way we all get along in the class, listening, positivity, good feedback, mindful check-ins. So I name that with particular awareness that as we instruct, we're not just instructing, we're very intentional about how we are relating to the men, how we invite them to relate to one another, and we're really seeing that that container of trust is allowing folks to openly share and grow in ways that are really important. So I'm thrilled to be part of that delivery team in the jail. And while I'm here, I also need to mention the other component that is part of Awaken Pittsburgh's work with Allegheny County, and specifically the jail and Department of Human Services. And that is that we have agreed to make available to folks in the jail and when they leave the jail a protocol called the Trauma Resilience Protocol for addressing post-traumatic stress or post-traumatic trauma symptoms. And so the Trauma Resilience Protocol is a method that neutralizes the emotional charge of traumatic memories without requiring the individual to relive that event or talk about that event. So we know that for many folks, lots of reasons why people won't end up going to therapy because of wait lists and stigma and all that sort of thing. And also for many, the idea of revisiting that trauma is just not tolerable. And so this protocol based on neurolinguistic programming invites people to just briefly think about the event and then turn their attention to circumstances before and after in a way that allows that memory to be stored in such a way that the intense activation from it is mitigated. So it's a somewhat novel protocol, I think, in this area. Awaken Pittsburgh learned of it a couple years ago when we brought when Dan Jarvis of Tactical Resiliency came into town and trained some therapists who've had great success using this technique. So within the last month, we trained 47 people here in Allegheny County, 9 of whom are employees at the jail. Another 4 to 6 folks have their clearances at the jail, and we'll be making this protocol available to folks on the inside. I'm realizing folks up front have a flyer about this with a QR code to where anyone in Allegheny County can sign up to receive this protocol. Those folks who were trained all made a commitment to offer 10 sessions free of charge to people in the community who may be in need. So anyone can find out about that at our website, awakenpittsburgh.org, under services, trauma healing. So I encourage folks to check that out. I thank you for the opportunity to work with the jail, and I welcome questions if there might be any.
Thanks, Dawn. We appreciate you being here.
Thank you.
That concludes the warden's report.
I just wanted to say thank you to the team for all the information and for sharing all the good news with us. And in addition to recognizing that there are, have been missteps and that there's room for improvement in areas. It's kind of a conflicting feeling for me when you want to kind of celebrate the services, the programs, and all of those kind of things that are provided to incarcerated people, but we really don't want them there to begin with. Sort of like, oh, they're still in jail, but but we're happy about the improvements in the services that they're receiving, and I look forward to whatever efforts, particularly with the manager of the population control. I can't remember what it is from. Avoiding them being in there is the first place would be the goal in reducing that population. But I appreciate all the accomplishments over the past year and your transparency, your willingness to share information and answer questions. And that's it.
Anybody else? Thank you. Since the theme of tonight is things we talk about all the time and haven't done yet, what is the status of worker pay at the jail?
As I said last month, we've onboarded the vocational training supervisor. She's finalizing testing of the software and ensuring that it's being implemented and that every person is being scanned whenever they show up for their vocational training or for their programs. We're finalizing some reports through county stat that we'll be utilizing to ensure that everyone gets the pay that they've earned. And we're looking to launch in the coming weeks.
Coming weeks, so by next meeting, people will be getting paid for their work?
Yes.
Okay. Every worker in the jail?
Barring there's no unforeseen hiccups that happen in the next few weeks, but correct.
Every worker in the jail?
As I have also explained, phase one of this is workers that leave their housing unit. So this will not initially impact pod workers that do some custodial work on their housing units, but will encompass all other vocational training in the jail.
With the plan being phase 2 includes pod workers?
We're looking at that as a possibility, yes.
Okay, thank you very much. Next question is, I received numerous reports over the past week and a half about a gun being brought into the jail through the employee entrance, up through security, onto the pod, and by a person who worked at the jail but was not legally allowed to possess a firearm, and then there being a cover-up of sorts of other employees after the fact. And I'm just wondering, one, how a person gets hired and passes a gun qualification when they are not legally allowed to possess a gun, and two, how a gun gets through security, because that's the entrance I go through, and I mean, I have to put like my pen and my notebook through the scanner. And so I'm just wondering if we could have a little information, as well as, have people been fired? Are people suspended? What's the status of that? And why the Jail Oversight Board wasn't notified.
That matters under investigation.
Okay.
That's my comment.
But is the Jail Oversight Board not entitled to be made aware of situations like that, of that gravity when they happen?
I made who I need to be made aware of it.
Okay. I would dispute that and say that the full Jail Oversight Board needs to be made aware of those incidents. It is a grave security risk, and since everybody seems really concerned about the security of notifying loved ones when their family members are hospitalized, I feel like this is something that maybe we should be notified about as well in the future, please.
Okay.
Okay, thank you very much. My next question is, I don't know if you guys get the online public comments that we get, but it's talking just, about a specific individual that I'm not going to ask any questions about, but something that I hear a lot from a lot of loved ones is that they call the jail, some number, and they're inquiring about their loved one, and they get talked to really rudely, they get hung up on, they get dismissed. And I'm just wondering, where are family members supposed to call when they have a question specifically about the medical treatment of their loved ones? Is there one specific number? Do you guys monitor and audit that number to make sure people aren't being rude to family members who are concerned about their loved ones?
Good.
I mean, family members call a lot of phone numbers. A lot of family members do reach our assistant director of nursing line, and they are charge nurses of the building. They're 24 hours a day, and they do answer what they can answer. However, with HIPAA rules, a lot of times family members cannot get the answers that they are looking for. And maybe repeated calls happen after that, and it is the same answer every time they do call. We can't give you information.
Okay, but are they being kind to them? I mean, I can imagine the reason they're calling is because they're concerned, and this is something I have heard hundreds and hundreds of times over the years, and this woman is saying that she was hung up on when she called. I'm just wondering if that's something that you monitor, how the
If you're getting notified of something like that, then tell me so I can look into any situation. But I mean, yes, our staff is all educated well on professionalism. They're all managers and know how to be professional with people.
Okay, and are they checking when they get a phone call? Do they check to see if this person has been designated as an emergency contact, and then they're sharing information if they're allowed?
If there's a release of information side, then yes, they can share information.
Which is different than an emergency contact designation. So they will not share information with an emergency contact. They will only share if there's been a release of information signed.
Correct.
And is that release of information something that someone does when they come into the jail through intake, or is that just the emergency contact process that happens at intake?
It's not an automatic process to get a release of information signed, no.
Okay, so we're not even asking someone if they want their information shared when they come into the jail?
We are requesting for emergency contacts to be listed in case an emergency happens, we can contact somebody to let them know that an event happened. But no, we're not automatically getting releases of information signed for any medical information to be shared.
Okay, is there any reason for that? I know when I go to the doctors, it's a question that says, who else can we talk to about your stuff? Why do we not ask that? Why are we just asking emergency contact?
So we just recently started gathering emergency contacts, roll out in phases. We can see how this goes and make sure people are actually able to provide us with emergency contacts. Because as we know, with events, we've had times where we don't have an emergency contact. And then sometimes people don't actually know who to provide us either. So it's not, when we get to the phase of trying for a release of information on every single person that walks in the door, that'll just be a different process to look at that time. We're just not there yet.
So then I'm guessing an overwhelming majority of people in the jail do not have someone listed as a release of information? If we're not asking for it?
No, because the population knows to ask for a release of information to be signed if they want information shared with somebody.
Okay.
Or when family members are calling, we tell them we need a release of information signed. They normally call their family members back and then they get it signed.
Okay, and so that is something that that is easy for them to do? Are they just like doing it on their tablet? Like, what is the process to get somebody to be your release of information?
Well, they can send a sick call, they can send a request on a tablet, they can grab one of the nurses on the pod, there's multiple ways to ask for medical staff to get a release signed.
Okay, and is the ADON the appropriate person for family members to call if they need information?
They should be calling the jail number.
The main jail number that's on the website?
They should be calling the main jail number.
Okay. When Renewal spoke earlier, they said that the jail decides if someone is revoked from Renewal, and so I'm wondering who in the jail is making that call.
So there's an alternative housing team in the jail that oversees alternative housing. And when there is violations that happen in alternative housing, they go there, they do a misconduct hearing in person with the alternative housing provider, and together they make a determination as to whether or not that person's going to remain in the facility.
So it's not how it kind of maybe sounded to me earlier, where it's just like,
No, it's not.
okay, I thought that sounded a little odd, so could you? So what happened? So I'm Renewal, it's 4 o'clock, someone was supposed to be here at 1 o'clock. I call the jail, well, no, I did it at 3 because I had 2 hours, right? I call the jail and I say, hey, Manny, of course, was late, right? Didn't show up on time. What do you want me to do with him?
So that's not how it works for somebody that's returning late to the facility. Okay, so there's escapes and there's hearings for people that are being revoked to the jail or had some behavioral infraction. So if Manny doesn't come back at all, after that time window, Renewal's going to automatically file the notice that goes out so that a warrant can be issued. If he comes back and the warrant has not been issued, then it would move through a progressive discipline process to a misconduct hearing. Typically for somebody's first late back to the facility, it's not going to even rise to the level of a formal misconduct hearing with the jail. The program is going to handle it informally and speak with that person, explain what the violation is, talk about what happened, what occurred, why they were late, and move on. Generally, it's probably 3, 4, or 5 times that person's habitually been late, then the jail would be called in to do a hearing. There's other things, positive drug screens, a variety of behavioral infractions that can happen, and generally those are handled through misconduct hearings. If it is putting someone at imminent risk, then sometimes a phone call is just made to the alternative housing supervisor and a decision is made to revoke. For instance, maybe somebody's just punch somebody, right? Like there's a physical altercation that occurs, and sometimes just for safety factors, decisions are made for people to be revoked instantaneously. And in those situations, the alternative housing team will see that person in the jail and explain what occurred.
Okay, and that alternative housing team, is that their like dedicated job, or are these people who serve other roles in the jail and just form this team like Power Rangers?
So they are Power Rangers.
Yeah, okay.
And they do this piece as well as the placements for alternative housing. So
Okay.
they're doing both.
Okay. Thank you. Follow up to that? Yeah, go ahead.
So the reason I asked that question, I was in city court on another case, and I was watching a hearing, and I was surprised it was a criminal case, but this gentleman was charged with a felony escape, and I'm listening to the testimony. I didn't hear every single word that was said, but what I heard was this person was a couple hours late, and they called and told Renewal that they were running late, and then they were not only revoked, but they were charged with a felony escape. So you're saying that doesn't happen, or is that inconsistent with the policy?
If they didn't return, the Renewal has, or Renewal Passages to Recovery, whichever alternative housing facility has that 2-hour window for someone to return. If the person's in contact, generally they will push that window back. But once it hits that 3-hour time frame, we don't know. Like 3 hours, you can go pretty far away. Like you should have made your way back to the facility by that point, and then the escape report gets filed. There have been situations where they showed back up at Renewal, and when it goes, for that preliminary hearing or formal arraignment, it'll be withdrawn. So it just depends on what the circumstances are.
Is there like a written protocol for this, or is this kind of like?
There's jail policy
case.
around the escapes and revocations, yes.
Okay. Thank you.
I just have a couple more. Thanks. My next question is about, we heard about the staffing analysis. Are we going to get a copy of that? Is that done? Can I have it?
When it's completed.
Oh, okay, it's not done
We're
yet.
still working on it.
Okay, it's like takes a few months to do?
We have to analyze each post and see what they're doing within it every hour for an 8-hour period. So we kind of got to look at each one of those posts. We are working on it. We have established a relief factor for that, but we're not to the point where we're analyzing each post.
Okay, and we will be provided with a copy of that when it's completed?
Yep.
Okay, awesome. I just know that consent decree, the Howard lawsuit consent decree, I know that they had staffing level requirements in it, and so I'm really interested in seeing like how we match up to that, especially considering the population in the jail has gone up drastically, like probably 200, 250 more people since that happened. Are you guys using that as part of your staffing analysis as well, like making sure you're staying?
The standards for the Howard settlement is a lot different than the staffing for corrections officers. So they look at, treatment hours and other parts of that. They don't just look at, like our staffing is for security, whether or not there's people there, what they're doing on their post, whether or not they're relieving, whether or not they're, there's a lot of different parts of it. And we're making sure that we should have a corrections officer in there as opposed to looking at alternatives to that to make sure we're using our corrections officer appropriately.
Okay, and the staffing analysis is only for corrections officers? It's no other stuff?
It'll be for corrections officers, sergeants, captains, the uniform staff.
Okay. And none of those are required by the consent decree?
No.
I think Deputy Warden Martin could probably chime in, but part of the monitor reports is that they do a.
Yeah, I've seen those.
I would say her next report should be coming out soon. That'll all be in there.
Good, I can't wait to see it. Thank you. Next is we used to hear like wait lists for sick calls, mental health psychologists. Do you still track that? I just didn't hear it.
I don't report it out every month, but you guys get that report every single.
Where is that? That's not in the warden's report.
It is. It's in the.
Where?
They email
It's the email. It's not in the warden's report. It's in a separate document.
Yeah, it's
Okay.
in the email that you guys get.
Okay, thank you. And then I thought I had one more question. I did have one more question. It was about tablets. First of all, where's the tablet contract coming?
Still in negotiations.
Okay. Two things that just came up, in preparation for this meeting was one, how high of a cost it is to replace it. Like I can get a state-of-the-art iPad for less than what incarcerated people are being charged when their tablet breaks.
We are looking at that cost as part of the new contract, but also, you know, that cost does not just incorporate the cost of the tablet. That incorporates the cost of staffing from the manufacturer, the shipping. You know, a lot of people have to put forth effort every time a tablet gets replaced, including assigning it. So it's not just the cost of the tablet, it's also staffing costs associated with it.
Yeah, but these are people who, I mean, I don't need to tell you this, but who have a very limited earning capacity while incarcerated. Right. And like, it's like $350, something, $300 and something to replace those tablets.
Yeah, and that, again, that is something that we're looking at as part of this new contract.
Okay, I just wanted to make sure that was on there. And then last question, 120 tablets out for repair at the end of January. That's the highest I've ever seen since we've been tracking these numbers.
Well, you know, part of looking at a new communication contract is hopefully going to come with new tablets. You know, we've had this same model of tablet for quite some time. Battery life is not what it was 3 years ago. Wear and tear. Our jail has the most damage than any other Viapath jail to tablets. So yeah, there's a lot more going out. And then those repair times, you know, although they're relatively still within the means that we want to see those turnaround timeframes in, there are a lot that are out.
Yeah, well, ending on a high note, I have gotten lots of awesome feedback about folks having increased access to charging their tablets. I know that was something we talked about for a really long time, and I just want to say how much a game changer that's been. Family has reported to me increased communication with their loved ones. Incarcerated people have said how nice it is to not have their tablet die in the middle of the day because that battery life does suck. So just whoever made that happen, thank you for that. I really appreciate it.
All right, just a few questions. My first one is, how is Ramadan and Lent going?
You know, minimal complaints. Any complaints that we receive goes to chaplaincy to be handled, but it's gone pretty smooth.
Yeah.
Yeah.
Yeah, I'll say so too. I haven't seen too much. I did see a few reports from the liaison about some food-related complaints, but they've all been addressed. So appreciate that. There was a question that was raised though about bottled water, like if somebody has an aversion to tap water or something like that. How difficult is it to get bottled drinking water?
You gotta be pregnant, right?
To get bottled drinking water, you have to have a medical diagnosis to support that.
Okay. She mentioned you have to be like pregnant. What type of diagnosis would like support that?
Those are the only people I know who get them.
We do provide water for the pregnant population, yes.
No, I got you. Yeah, but what else is the question?
There's a few other diagnoses out there that, you know, if hydration is a key part of it, then, you know, our medical director and the other physicians will, everything is a case by case for medical diagnosis, but you have to have a medical diagnosis that requires it to pour bottled water.
Okay. All right. My next question is, always happy to hear about population management. I know Gary Copeland is here, but also the person who, unless I'm wrong, the person who runs the pre-arraignment diversion is here. I'm hoping to get an update on that. How's that been going?
So there's been positives and negatives around pre-arraignment diversion. The negative has been staffing. So we on the jail's end are still trying to get a full complement. We have a couple of individuals that we're looking to extend offers to soon. So we're hoping that our complement will then be full. And as you probably already know, we partner with Unity Recovery for those services as well. So they're meeting with people down there in pre-arraignment, and they also are increasing their staffing. So just looking at getting coverage down there outside of, currently it's pretty much daylight 3 to 11, looking at overnights, weekends, and increasing staffing. So as people are onboarded, we'll be able to support around the clock. But we have had people getting diversionary plans and judges agreeing to it. It's been a lot of work and a lot of education, but we're excited to finally see it coming off the ground.
Right. About how many people have gotten it?
I think in the month of February, we had 9 people that the courts agreed to divert. And I believe in December and January, it was around 20 each month.
Really?
Yeah.
Okay. How hard would it be to make that a part of the numbers that we get monthly?
It's included in the report that you get submitted. I just don't say it orally.
Oh, well.
Yeah. It's in the emailed report.
Oh, in the email report. Oh, I got to get better at my emails. Okay. All right. My next question, was happy to hear the presentation from Awaken Pittsburgh. Overall, happy to hear about how much you guys are focusing on programming. Hear a lot of like positive feedback about it overall, and I think this is another great program for the jail. I was hoping to ask just like one question to that lady if she's still here. Okay. If not, maybe, my question is about the class, like how many participants are in the class, or like in programming in general, like
Yeah.
how many people, participate?
So
in
the
program?
maximum number of people in each class is 20, and the number of participants can vary day to day. It depends, if someone has court or a meeting with their attorney or a medical appointment, they may not be in class that day, but they'll be in the next one. So maximum of 20, and then it truly varies day to day.
I got you. So with that program, you may not know, but with programs in general, thinking about how quickly the jail population can turn over, like somebody, may not be there for long. Is each class like an all-encompassing class, or is it something that somebody has to show up to multiple times to get like the full breadth of it?
Most of the classes in the reentry center run on a 6-week rotation. And those classes generally, if you were just taking them outside of our jail setting, would be 12-week classes that we condense into twice a week so that we can get it done in 6 weeks, because we know the quick turnaround and we know how eager people are to get into those classes. So 6 weeks is generally how long most of those classes take.
Okay, I got you. And is that available to everybody, or do they have to like be on a whole pot?
No, it's available to everyone. We prioritize the wait list, so people who are in our intensive reentry program are going to be priority for that. And those individuals are generally people that are at highest risk to recidivate. So, we prioritize programming based on that. But everybody that's interested goes on a wait list, and then as soon as we can get them into a class, we do.
I got you. And they sign up on a tablet?
They can sign up on a tablet, they can write us, they see people on the housing units, caseworkers. There's a variety of ways they can ask to participate.
All right, I got you. Thank you. That's it for now.
I have a couple questions. Deputy Warden Martin, or maybe Deputy Warden Clark, as far as sending people to Norristown State Hospital to alleviate the waits for Torrance State Hospital, how's that going so far?
It's pretty good. I don't have the exact number in front of me, but I can report that off for next month, but it's been going fine. Is it 8? Thanks.
What is the current average wait time?
Well, right now we still have 18 on the list, and the longest waiting since October. So they started, I think it was 2 one week and then a couple the next week that they took. But I can start reporting it out differently.
But are we better than we were before Mobile Competency Restoration Unit came in?
Oh, yeah, we're definitely doing way better.
Okay.
We're definitely doing way better.
I know I ask this question every month, but with respect to 5F and moving people off of that floor so people can have better opportunities for rec, do you have a timeline yet for when that may happen?
We're just still working through the facility needs on that pod. It's working, though. There's always work being done up there.
I think in a month?
I'm not guaranteeing anything. I don't want to put a time out there.
Okay. Thank you.
Yeah, I got a report that there was like a celebratory basketball game for the incarcerated individuals, like on one of the pods, to like thank them for doing good at something. Can you tell me a little bit about that? I'm sure I'm explaining it poorly.
No, you're pretty accurate. The level 4 unit managers did an incentive program, and one afternoon, a couple afternoons, they opened up the big gym to allow some guys to play a game. But you may be referring to something that Major Vancheri's working on for March in conjunction with March Madness. They're going to do a whole entire facility foul shooting contest for the whole jail to bracket it down to a winner.
That's really cool. I was actually only knew about the first thing. That second one sounds cool as well. But I heard that there was like a hiccup because while it was happening, the like intel team went in and shook everybody's cells, and they came back and their cells were all everywhere.
I was there, and the Intel team was in the gym with me.
Oh, so that did not happen? There was not a shakedown during the game?
First time I just heard of it.
Okay, I'll talk to you about it after. Okay, thank you. Thanks, Judge.
Thank you. Public comment, John Kaskowitz.
Our correctional officers' perception of our Jail Oversight Board. In our 2025 CO Job Satisfaction Survey, 217 of our officers responded to this statement. Our Jail Oversight Board communicates effectively with our officers, understands our officers' challenges, and is effectively working to improve conditions of employment for our officers. 72.4% of our officers strongly disagreed with that statement. 18% disagreed, totaling 90% of our officers. 7% were neutral. The following open-ended statement question was provided to our officers. What recommendations do you have regarding how the board could be more actively involved and effective in improving the working conditions on your job? Though there was a plethora of complaints about our board being tremendously biased in favor of our residents and targeting our officers with biased narratives, officers did say they want to make bridges, develop understanding, and work with the board to improve their working conditions, which will indirectly benefit our residents. In analyzing this data of over 90% of our officers disagreeing with the above statement, I want to use a methodology of organizational experts, such as Stephen Covey, recognized by the DOJ and the National Correctional Institute. I do think there would be agreement with the officer's perspective that there is a problem of culture on the board, a bias in favor of the residents, which explains the lack of focus on the officer's needs. They would further say that the absence of informative contacts with the officers contributes to this problem of what the officers are saying of the board's culture. Bethany's refusal to sit down with the frontline officers as head of the Use of Force Committee's officers find to be a travesty. Rob Perkins' refusal to respond to my emails and what I've said to him regarding what some of our frontline staff are saying about our two prescribers, one of whom has recently resigned after some of these issues were raised, is more of this obstinance and preventing him from seeing what is really going on with our health care. There are other oversight entities, such as NCCHC and the State Office of Professional Conduct, which I think will be very receptive to what needs to be said. I have a relationship with both. Turning my attention also to the voters of Allegheny County who might be watching. Boy, that goes quick.
Thank you, Chair. I would just like to remind any county employee that may be listening that our countywide employee survey is in your inbox. It's the third time we are doing it. It just requires your county login, but please take it. We do read every response. We compile them based on department, and we have enacted significant HR policy changes and employee benefits because of the feedback we received from our workers. So just a reminder. Thank you.
Thank you. Diana Hall.
Diana Hall from the Pennsylvania Interfaith Impact Network. I was going to ask about the compensation program that the county council funded 2 years ago, but I'm glad to hear that it is going to be implemented. That's wonderful. But I am concerned about the exclusion of the pod workers who clean and maintain the pods every day. Their work is essential, and it would be nice to have an explanation as to how that decision was made and whether it can be revisited. Finally, the proposed daily rate does not reflect the actual hours worked. An hourly rate is more equitable, especially when shifts vary from 1 hour or maybe 3 hours. So I hope the board will seriously consider adopting an hourly structure. My intention is not to complain or to blame, but to encourage timely action. The workers who support the daily operations of the ACJ deserve fair and prompt compensation. Thank you.
I'd first like to thank you and the Renewal Center for the collaboration with Colorful Backgrounds, and also especially specifically to Connie Clark for giving the PIN members the ability to and the opportunity to donate books. It was a very joyful process, and we were all, I speak for everybody from the organization, we were all so happy to do it. We at PIN have been waiting a long time for our neighbors in the jail, for all workers among them to be paid for their labor. And we would like to include the pod workers. It was funded 2 years ago, and like Diana just said, we are very grateful that by the time we get here next month, it will be happening. We are also concerned, though, that it doesn't include, I'm going to reiterate, the pod workers, and it is our hope that that can be revisited. We are so very grateful that the JOB voted for this, and we are grateful that there's continued questioning from the JOB in terms of moving this forward. We want to make sure that that happens, because this is one just act in such an in any portion, in anywhere in the carceral system. And I think we in Allegheny County, the administration, the JOB, we can be very proud of the fact that we justly are going to pay people for their labor. And now, if you are able, please rise for the reading of the names of the dead. And I just want to shout out, I don't know where Miss Marion is. I'm concerned, and I just am saying hi to her if she's watching. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Somm, Nicole Barufi, Richard Shuba II, Terrence Clowney, Tracy Hickey, Justin McAuliffe, Nathan Piernick, and Mark Schwartz. Thank you.
Hi, Malakia Contreras, criminal defense professional, mitigation specialist, criminal justice educator. I'm here again to raise the concerns that I raised previously for the conditions surrounding Mr. Edwin Wiley Biggs, who's in the Allegheny County Jail. They have not been corrected. As of today, he still is being held in a cell without functioning lights. He can't read his legal materials. He can't review discovery. He can't meaningfully assist in his defense, and his tablet access is still withheld, preventing him from even communicating with his legal team. This is not a minor inconvenience. It is an obstruction to the constitutional right right to counsel and access to the courts. What's more alarming is that in the last week, Mr. Biggs has documented epilepsy, and in the last week he suffered 4 seizures, including one severe enough for him to be transported to the hospital, which his family was not notified of. He's returned to the same dark cell. The only semblance of a justification that we've heard in response to this is that he's recently been charged with additional nonviolent street crimes. But let me be very clear about something. It's jail. Everyone inside of the Allegheny County Jail is there because they've been accused of or convicted of a crime. That reality does not strip them of their humanity, and it certainly doesn't absolve the jail of its legal obligations to provide humane conditions and protect constitutional rights. Anything implicating that is a fundamental misunderstanding of the criminal legal system. The purpose of criminal defense is to advocate for the civil and constitutional rights of people accused of crimes. Those rights do not only apply to people we like or that we feel comfortable defending. If they were like that, they wouldn't be rights at all. There are individuals incarcerated at the ACJ accused of the most violent and heinous crimes imaginable, yet they do not receive this kind of treatment. So the question becomes, why is it happening here? What we're asking for isn't extraordinary. We're asking for basic human conditions, not privileges. These are the minimum standards required in a constitutional democracy. At this point, the continued refusal to correct these conditions raises concerns about everyone in the facility and the equity of fair treatment.
I know you guys missed me last month, but I'm back, so everybody be happy. But one of the things I was thinking about, and one of the things that we're contacted about a lot at my job, are individuals who have been assaulted by officers. A lot of people refer to them as uses of force, but they are assaults. And I was looking over the data that's provided to the state on the state's website, and one of the things I found interesting is that since 2018, 0 assaults have been reported to the state of staff assaulting incarcerated people, which we know to be untrue because Robert Beath was fired for assaulting an incarcerated individual. And unfortunately, the union fought for him to get his job back despite court charges, but he did assault an incarcerated individual. And I find it very hard to believe that no incarcerated individual has ever been assaulted by a staff member since 2018. And when I was digging deeper, I was looking into deaths that are reported to the state. And last year, they said that only 1 person had died in the ACJ. The year before, they said only 4 people had died in the ACJ. And there are remarkably low numbers reported to the state of people who have died in the ACJ, when we know, just given the numbers that Sharon reports starting in 2003, that over 20 people have died in the ACJ. And that's not being reported to the state. And if funding and the way we look at criminal justice and the way we look at how people are being treated are dependent on those self-reported numbers from the ACJ, then there are a lot of people who are not being advocated for, and people are not understanding the true picture of what is happening in the ACJ. And when these meetings are called biased and the board is called biased, I think people need to understand that that bias comes from the fact that the people who really need to speak out can never attend these meetings. So the corrections officers have showed up here, and they have given their opinion, and they've made their opinion known, but people inside the ACJ have no way to do that. And since the only recourse they have is to go through the liaison, and that's often not heard, I think we need to find a way that they can participate in these meetings, and I do think we need to look at the way the ACJ is reporting their numbers to the state. Thank you.